Welcome to the podcast, Wellness 3.0 Unlocked. What if detecting one of the most common and most overlooked cancers could be done in just 10 minutes from your phone? Today's guest is Stephen Bonner. He's the CEO of SkinIO, a company on a mission to fundamentally change how we approach skin health and early cancer detection. Skin cancer impacts 1 in 5 people by the age of 70, yet millions of cases go undiagnosed simply because screening is either inconvenient or overlooked. That's where SkinIO is stepping in, leveraging AI-powered imaging and telehealth to make full-body skin checks accessible, fast, and actionable from anywhere. Steve is leading the charge in redefining preventative healthcare, combining cutting-edge technology, dermatologist expertise, and a seamless connection to care model to catch these issues earlier when outcomes matter most. In today's conversation, we're diving into the future of healthcare, the role AI is playing in early detection, and how removing friction from the system might just save lives. Welcome to the podcast, Steve. Really excited to have you here. This is such an important topic, and we're really excited to have you.
Wonderful. Thank you, Beth, and thank you for the great overview. Let me just say at the end, this is saving lives, and we'll talk about it in some detail, but it really is a very powerful breakthrough on quality, cost, access, and outcomes. So let us arm your audience with enough information to challenge what we think we're doing and then take action and enjoy it if they think it's worthwhile.
Yeah, I'm excited to dive into all of that, the mechanics of what the journey looks like for a potential patient and also a lot of those statistics. But first, let's start a little bit with you. So you started your professional career as a lawyer, meandered through some things, and then ended up here at SkinIO in 2023. But tell us a little bit about that whole journey.
Sure. As you say, I'm a recovering lawyer. I worked in financial services for the first phase of my career and built 3 multi-billion-dollar businesses inside of big financial services firms. And I'm sort of a serial entrepreneur, innovator, always provoked and attracted to good ideas and great people. And then I was introduced to the founder of a company called Cancer Treatment Centers of America in the mid 90s and wound up joining them as CEO, my first foray into healthcare. And it was a very unique breakthrough approach to holistic cancer treatment and direct-to-consumer offering in cancer care. It was very unusual, and I stayed there for 15 years and grew it to a very large full-service cancer treatment company focused on late-stage cancer around the U.S. And then I agreed to stay 15 years. I left, and now I've transformed my professional life into that of investor and innovator. I have 25 companies where I'm an investor and working with teams around great ideas and looking to try to make healthcare much more accessible and effective, efficient, and effective as well. And one of them, which I discovered about 4 years ago, is SkinIO. And I was very attracted, and am very attracted to the technology and to the process and to the market and to the 30 million Americans walking around with undiagnosed skin cancer today, who prior to SkinIO, as you were suggesting, have a very constrained ability to get their skin checked and evaluated and get to care if they need it, because dermatologists today are so busy with many forms of skin needs.
Wow, you're like a little mini Shark Tank, Steve, with 25 companies. Are most of the companies that you've invested in the healthcare industry?
They're all in healthcare.
All in healthcare. So
Yeah.
that's where your passion and your focus and your financial resources are lying at this point.
Well, and where I hope my expertise adds something too, seeking to find companies where I can not just add a few dollars, but bring some of my experience and knowledge to help a great idea with a great team have a chance to get to market.
So let's dive into SkinIO now a little bit here. So the company actually started back in 2015, I believe it was, maybe launched the app around 2017, and then you came on board a few years later. But tell everyone exactly what SkinIO does, how it works.
Sure. So maybe let me describe the current situation. and then I'll describe what SkinIO does to make it different. And today, if you wake up and you see something that worries you on your skin and you think it might be cancer and you want to get it checked out, you call a dermatologist office and say, I need to see a dermatologist to have them look at my skin, possible skin cancer. And they say, great, we have an appointment available for you in 6 months at 7 in the morning. Do you want that? Come and be here. And many people are frustrated by that and say, well, let me try some other places. But generally, 3, 6, 9 month wait is what is available. And then if you do that, you go in and you get a 15-minute appointment with a dermatologist who looks at your skin and then decides if there's something that needs further biopsy or diagnostics or treatment. It costs $300 for that appointment. And again, you've waited months and you've driven across town. You have to wait in the waiting room. You have to go in an exam room, et cetera, et cetera. So what we offer is an app that we download into our phone or our iPad, and it uses AI in the application to guide us through a full body skin scan analysis. So it's like facial recognition software. Starts with head and neck. You get a white outline, and then the AI in your device starts helping you make sure you get a quality image. Gets angle, distance, lighting, and as soon as it gets a quality image, the white turns green and it uploads the image into our database. And it takes you through that 13 regions of your body, photographing as much skin as you want to reveal. Most people will be in a bathing suit or underwear or something like that. Takes 10 minutes, and you've completed your full body skin exam. It goes up to our database in the cloud, which is also AI driven. And what it does is it starts by computing the mathematical equivalent of each patient's normal skin. So it's very personalized. And then it looks on all the scans for anything that is a statistically significant outlier that might suggest skin cancer. So a freckle or a tattoo or a piece of jewelry is not statistically significant. It's an outlier, but the technology knows that's not got anything to do with skin cancer. So it highlights any suspicious spot on your scans, and then the full set of scans go to one of our panel of reviewing dermatologists, and they look at it. They can zoom in on it, they can expand it, they can measure it, they can gauge the color of it, and within 2 days you get a report back. So 10 minutes and then 2 days you have a report which says one of three things. And about 2/3 of the people we scan, we say, there's nothing here of immediate risk, but we've got your baseline scans now. This is skincare for life. You should scan periodically, and every set of scans will automatically compare with the earlier scans, but you don't need to go fight your way into a dermatologist office. And then about 20%, we say there's something here that doesn't look like skin cancer, but it could develop into skin cancer. So we're going to want to keep an eye on it. And when you go see a doctor, take your scan with and make sure they look at this particular spot. And then about 8 to 10% of the people we say, there's something here that needs to be seen in clinic by a dermatologist as quickly as we can possibly arrange it. And then the real link in our golden value chain is that we offer to have the patient in a clinic with their scans within 2 weeks of the time that we discover the need to be there. And so with us, from the day you're concerned to the day you're in treatment, if you need it, is 1 month rather than waiting 3 to 6 months to find out if you really need it or not. And so the technology is pretty simple, pretty intuitive. It's best done with a friendly photographer. We have a pure selfie mode, but obviously catching your back with quality images by yourself, you got to get it set up on something and then it talks to you to get the right angle. But it's easier if you have a friendly photographer that you can use. It's simpler. Our cost is $239 for the full set of our value chain. So the app, the scans, the evaluation in the cloud, the dermatologist review, and getting you into a clinic is $239. So it's much less expensive than the conventional 15-minute exam. And it's also more accurate. Stanford Dermatology did a study of our technology and published a paper, which I'd be glad to share with anyone, and said, we think that a well-practiced, experienced dermatologist doing that first 15-minute look with their eyes might approach 80% accuracy in finding skin cancer. And they said SkinIO's technology performs at 95% accuracy. So it's also much more precise and accurate. And it makes sense. It's using technology to take some of the human fatigue and, distraction out of the equation and equip the dermatologist then with a much more precise assessment of where they should be looking and what they should be looking at. So we think it really is helpful to the dermatologist. It's helpful to the patient. It is going to transform the whole skin cancer spectrum because we know that skin cancer is eminently treatable if you can find it early. And kind of chuckle that the healthcare system will pay for all of us to get 2 dental exams every year, no questions asked, but nobody dies of cavities that I'm aware of, or very few, whereas there's still a lot of resistance in the system to offering everybody a chance to get a skin scan once a year, which would really get to the early detection, early connection to care, transformative potential that lies ahead.
Yeah, you alluded to some statistics there, and I had done a little research that about 5 million people are treated each year for skin cancer, and we have 9,000 deaths a year. Also, if detected early for melanoma, which is the most deadly kind, and typically the deadly kind, if you get it early, there's a 98 to 99% survival rate for 5 years with early detection. So it truly is life saving. And I had shared with you before my own little journey with some skin cancer. I was a teenager and young adult in the 80s and early 90s. That's when most of my bad decisions were made during that decade, include that, baby oil was just what we used. And if we were being cautious, maybe we used a Hawaiian Tropic 2 or something like that. And I certainly checked a lot of the boxes for someone who was at risk. In fact, I took your Fitzpatrick skin type quiz that's on the website, which is a really useful quiz. I encourage people to go to the website and just to do that, if nothing else, as a start. But I had a couple of bad burns, blistering burns, even though I have the darker hair, the darker eyes, my skin is lighter, and I checked a lot of those boxes. And when I went to I've had a couple of basals and squamous cells burned off, removed over the years. And so I've been really diligent about going to my dermatologist on a yearly basis. And I have a lot of faith in my dermatologist, but I had a little tiny spot on the side of my nose that wasn't even dark. It looked almost more like a callus. And I wish I had had this tool then, because I would have just taken a picture and sent it to you guys and said, hey, but because it didn't fit the sort of, uneven borders, dark, I just waited till my next appointment, which I go yearly. And she missed it on the first go around. She did the scan and didn't even bring it up. And I said, hey, what do you think about this? Is this just a callus for my glasses or is it something? We did a biopsy. It ended up being squamous. I had to have a Mohs surgery. I had a nice 2-inch scar on the side of my face, on the side of my nose, which, no one wants, especially a woman. I mean, you guys can, look tough and be cool with your scars. You don't
Right.
really want them on our face. And I think, wow, if I had had access to that, maybe I would have been much more likely to take a picture and send it in and get some feedback. And I might have avoided this longer treatment journey that I had to go through, this bigger scar that I'm currently trying to minimize as much as possible. And I see, even just in my own personal experience, how that would have really been helpful, which leads me to a kind of a specific question. So someone uploads their photos and now you've got them on record. Like, say something like that popped up after they had done their first approach with you and they said, hey, I see this other little spot. Could they just upload one photo, ask a question specifically? Is there like communication available at that point?
Yes, we can do that. And also during the scanning process, we encourage people to take discrete photographs of anything that concerns them to make sure that we don't miss anything that they might be seeing that is not immediately obvious to the technology, although those should be rare. Right now, our business model is primarily on a per scan basis. We're looking at, as we get ready to really launch a direct to consumer model, more of a subscription model where you could pay so much a month, and then you can have access to our technology and our services for exactly that kind of a quick check. But we would do that for anybody who'd done their scans with us anyway.
So you mentioned a direct to consumer model is launching soon. At this point, you're currently mostly working with like an employer benefit groups. Is that accurate?
Exactly, yeah. Large employers, United Airlines is our biggest employer group, and then they cascade down. We have about 65 employer contracts, have some union contracts in there as well. And we're also increasingly becoming adopted and available in primary care practices where your annual physical physician is worried about skin cancer and doesn't have good access for you. And now they can do their scans the same day they come in to do their blood draws and so forth, and then come back 2 days later and have the results of the scans and the connection to our care network if they want to do that. And that's a SaaS model rather than a per scan model. The physician clinic, and we have some dermatologists. The future is this should be in every dermatology office, but we'll get there. But they pay us to install and teach the technology, and then they pay a monthly SaaS charge that's tiered based upon how many scans they run through it for their employees.
Yeah, I was curious how dermatologists, I know that you work with a network of them and you then refer people if something sort of is lights up that might need attention. But overall, are dermatologists embracing this or do they see it as competition?
Well, there are a couple of things. One is they don't get a chance to really look at it in detail, but when they do, the instinctive AI is going to take our jobs away can kick in. So there's an upfront investment, and they need to believe in it enough, and we may need to fuel the upfront investment with something from us to make that easier for them to get it in. But it's so high potential for a dermatology office. And I just talked 2 days ago to CEO of one of the largest roll-ups, and he's intrigued. And right now, for them to do that eye skin exam, it takes 15 minutes for a dermatologist and a mid-level in an exam room, and has an 80% accuracy rate, and they can't be making any money on it. And if somebody called their office and said, I need to come in for a skin exam, and they said, well, let me connect you to this app and let's do your first scan at home. You can do it yourself, do this, then we'll get to see the scans, and then we can decide whether you can come in, whether you should come in or not. And we're always happy to see you, but let's do that. Immediately, they're going to see a lot more patients because right now they're telling those people 3, 6, 9 months before you can get in. Now we've got you 10 minutes away from your initial exam, and you're creating a new relationship for your practice with this new patient. You're innovative and forward thinking and available. It's a really nice step up in their market. And then also the accuracy of it, the persistency of it, and the technology of it is also very helpful. And they will only see in clinic then the patients who really need to be seen and treated. The dermatologists practice more at the top of their license rather than doing these 15-minute skin exams. There are some reimbursement challenges. We don't have, as I mentioned before, with the dental industry, we don't have all those hurdles cleared away. We've got some very supportive insurance companies that move it right through their claims process, primarily because that's what their employers want. United Airlines drove that for us with the Blues in Illinois. And then there are others that are coming up the curve, making it easier and easier. But we need to get to where we can prove the value of this and get them all saying, my gosh, why wouldn't we want to pay for this and run it through the claim system and make it easy for everyone?
Yeah, it seems like from a practice perspective, like you said, the efficiency, the accuracy, it's just a no-brainer, but it's not always that simple because some of the struggles are downstream insurance and things like that.
Yep. Also, every practicing physician has 10 people every day ringing their doorbell saying, give me an hour, I can give you something that's going to completely transform your practice. And then on the other side, the whole system saying, see more patients, see them faster, see them shorter, and charge them less. And so their patience and ability to really dig in and look at some of these innovations is a challenge. But
Mhm.
I think with the larger roll-ups, they've got some corporate resources that can take the time to do the front end and then maybe bring in one or two or three of their most innovative dermatologists, and we can do a pilot with them and then show everybody how effective and efficient it can be.
And speaking of struggles, so SkinIO had been off the ground for a few years before you came in. So they had already kind of done that first phase, but you alluded a little bit to some of the current struggles. What are some of the ones that you've sort of helped navigate since you've come on board as far as growing the business?
Well, I mean, the whole move to market component where, we've got a really nice small team that understand the technology, believe in the technology, and that are very good at finding and communicating with prospects on the corporate side. We've also got now growing numbers of intermediaries that are big believers for us. Memorial Sloan Kettering is a big believer for us. They're introducing us to a lot of their big corporate clients, and you get an endorsement from Memorial Sloan Kettering or United Airlines, and you've got some real credibility in the market that it takes a while to attract otherwise. So getting that going, the management of the scanning process, and we have talked about our at-home scanning delivery, but we also do on-site events for employers at health fairs and so forth. And so getting a team that can be out there and conduct scans on site is another place where we put a lot of energy into it. We've continued to improve the product, the accuracy and the sensitivity of the AI. We've got some future generations of the technology we'd like to move towards. And so we're continuing to work on that. Safety and security of the technology, we've definitely ramped that up. We're fully compliant with HIPAA. We're right in the home stretch on getting our SOC 2 approval. We're through the audit process, and we'll have that so we can assure our people that their images are secure, which is another intuitive hurdle when you have a new customer and you say, take off your clothes and send us some pictures, right? And we obviously don't present it that way, but that's what it is. And we can assure them and prove to them, number one, that the pictures come out of their device. Nothing is secured on or stored on any device. Everything comes up to the cloud, and there it's fully HIPAA secured. The patient is in complete control of their images. The only people that get to see the images are our reviewing dermatologist panel, and then anybody the patient wants to give them a chance to see. For example, as CEO, I cannot look at any individual patient images in the system. It's all pure need to know. So we've had to make sure that we can give people that assurance. It's especially important to our employers who are in effect sponsoring what we're doing. So we've really come up the curve on that front. The insurance reimbursement, FDA classification is another frontier where we're making some progress. Not to get into the FDA details, but we are a device under the FDA classification, and we're FDA Class 1 registered. So we've registered with them. They're aware of it. They've looked at our technology. They haven't approved it, but they're satisfied that it's low risk and doesn't require any other regulatory oversight. But we would like to get a de novo classification, which is the FDA saying there's nothing, no technology like this anywhere else in the market. And then also let them see our accuracy and efficacy data and have them pre-approve it, so that then that really reduces the barrier on getting insurance reimbursement and Medicare reimbursement and so forth. So we've done the spade work on that and would love to get through that process in the next several months.
Well, I'm glad you brought up. I was going to ask you specifically about HIPAA and also just privacy. So you've really already answered those questions, but I know that that would be a really common thing for people to be concerned about when you're taking pictures and uploading. And, there are other websites for that.
Yep.
And so I think that that really answers that, and people will feel just really secure knowing that what they're putting out there is safe, it is protected on all the levels. Speaking of things that you're kind of looking forward to and you're currently working on at this point from a business perspective, what is on the horizon for SkinIO in the next 3 to 5 years?
Well, the primary objective is to scale the business.
Mhm.
And we did $1.5 million of revenues last year. We'll do, we hope and expect, close to 4 million this year. Kind of looking at tripling the growth of the business every year. So You take 4 and you triple that and you get to 12, and then you get to 36, and pretty soon you've got a sustainable business. Getting the brand established and trusted and recognized is another big part of scaling it. And we're going to open up the door much more aggressively on direct to consumer. And there, the front end is education and trust until people understand what it is and trust you. Then they're not going to grab your app, download it, and send you some money. And so we're working on that. We've got a couple of really exciting public relations pieces coming out. There's a business magazine that's next month publishing a front page article on SkinIO, and then we've got another public service announcement development firm that we've partnering with. We've done a first draft of the script, and they're going to have Morgan Freeman narrate a SkinIO story and then put it out as a public service announcement. Getting those kinds of independent authors, sponsors to say they've looked at us and they think that there's something of value also will help us on the direct to consumer side. The technology right now, it's 13 images. We think about maybe a more continuous series of images taken not as snapshots, but as a device that you rotates around you and just scans as you go. Might make it simpler and easier and potentially more accurate. But we continue to, really push our AI to help us make sure that our discernment of what we think we're seeing is as accurate as possible and as flexible as possible for the professionals to work with. As I mentioned, it's already possible for them to zoom in on a spot and to use the technology to measure it precisely and to expand it, contract it, discern the colors of it as you were describing. And all that should be helpful. And we would like to get a lot more output data back from the clinics that see our patients. We'd really like to get what they did in the clinic, what the diagnosis was, what the treatment was, what the outcomes were, what the costs were, so that we can continue to feed that back into our data and be sure that what we think the data is seeing and the technology is seeing matches with what we're seeing clinically.
You mentioned you'd like to get more output from the clinics back to. Is there a roadblock now why they're not doing that?
Yes. Number one, the best way to do that will be to get integrated with their electronic health record system. And we have been a little bit integrated with ModMed, but we don't make it real easy for them just to get it in their records and then send their records to us. That's job number one, I think, to really open up that flow. And also, they don't have a big motivator to go to the trouble to share that with us. We need to connect the value chain and make sure that we're all winners, and they will be winners if our technology can get better and better in matching what it's seeing to what the professional sees and concludes with all of the technology and expertise they've got in clinic.
You mentioned a few ways that you guys are using AI, and it's a big component of that initial scanning. But if there was some other component of your business that you could just wave a magic wand and AI would take care of for you right now, what do you think that would be?
That's a great question. And the only thing right now that pops to my mind is to really enhance the effectiveness of our engineers. We have a team of 6 engineers that are working with all aspects of the product, and they're already adopting and using AI technology for programming purposes. And so helping them cut through a lot of the clutter on quick and easy use of AI. I think there's some applications on the website that could be very helpful. Our website has been coming up the curve, but it's not down the road as far as it could be. Undoubtedly, some things with that AI in terms of managing the client relationship. As you were saying before, what should we be doing in prompting our patients to get an update? Anything that's new, anything we can be helpful with, easy capture and transmission of images or data. It could also be a helpful place for some AI applications at SkinIO.
If any other healthcare founders were listening in right now, what's 2 pieces of advice that you would give them when starting their business? And specifically, where would you also recommend that they start using AI integrating into their business?
Well, I think the fundamental asset for young to be great healthcare company is the idea.
Mm-hmm.
And curating the idea against several filters is really important because good ideas are a dime a dozen. And in healthcare, the ramp is so long and there's so much change and competition going on. You need to look at your idea in the market context and ask yourself, number one, is this really going to make a difference? If it works, what's the difference it's going to make? Who are the winners going to be? And then what's it going to take to get there? Is this a 2 year to market kind of a development, or 3 year or 5 year? One of the maybe the best company in my portfolio is one that's going to completely transform the auto injector market. And we started investing there 6 years ago, and they're still not in the market. They should be in the market next year. And so you need to know that, and you need to be confident that there's going to be then enough money to help get you through that phase and get you to revenues. So who are the capital sources? Where are they going to come from? And how are you going to be able to fund it? Also, the team around the table, it's an enormously talent dependent process to come up with these ideas and then develop them and prove them and get them to markets. As you look around your executive table, do you have the people that you need, and can you afford to get them to make sure that your partners on the journey are going to all accelerate their part of the development responsibility? Where to use AI? I mean, it's intuitively sort of the sooner the better, the earlier, the more efficient it might be. Then it becomes very dependent on the actual idea. But just thinking across my portfolio, I can't think of any company that's not pushing itself with respect to AI and the use of AI to try to deepen and enrich the value of what their idea is and accelerate development and move to market.
Yeah, I imagine the runway for healthcare is longer than many other businesses because of the amount of hurdles that have to be overcome. So you've got to have long term vision, some tenacity, some patience as you navigate all of that. And ultimately, I don't think that you can speak to a person, particularly here in the United States, who isn't frustrated by the lack of time that we get when we actually do get in to see a physician. So, my hope with our company, Soaring Solutions, is always that we can help companies regain some of that time and hand off some of those tasks that take away from the human interaction and allow them to have that more face to face personal connection, which is not only what patients are craving, but allows them to do their better job. And I know is also very stressful for most physicians. They feel like they're always playing beat the clock to get in
Yeah.
there. So I think that what you're doing is such a valuable service, truly life saving for so many people. What do you think is there something that maybe people still believe about skin cancer or screening that is a myth that they're getting wrong?
I think one myth is that it's an old people's disease, and that makes sense. It's a cumulative effect of sun that's a big driver for this. But the latest data is very interesting, and it shows that incidence of skin cancer is occurring earlier and earlier in our lives, and especially among women. And we should be diligent about our skincare. And we've learned a lot about that. When we were growing up, a little baby oil and all the sun you could get was the way we approached a sunny day. And we need to get a regular part of our daily activity, and certainly when we're going to be outside, is sun protection. But there are going to be other things we're going to learn about what's going on genetically and genomically and in the environment beyond sun that is making us more susceptible to skin cancer, and why younger women more than younger men. I personally wonder about what we've done to our bodies with the wave of COVID vaccines that we were all required to subject ourselves to without many years of testing for side effects. And is there something? I'm sure there are things going on there that we don't understand and appreciate yet. And I'm not saying that's what's going on with the skin cancer incidence, but I think the general awareness that your skin is your largest organ, you're going to live in it all your life, you're living longer. We all like to look better longer. And as a result, it belongs in the regular rhythm of how we take care of ourselves. We go to the gym frequently. We know that's important. Well, what should we be doing for our skin? And my mind, topical application of appropriate products on a regular basis and a regular skin scan could go a long way. We've had people say, you're scanning for skin cancer now. What else could you scan for? And the answer is, and that's maybe back to your AI question, there's a lot we could scan for. And Johnson and Johnson's Skin Innovation Lab contacted us wondering if we could help them with their clinical trials, where they're doing different skin condition clinical trials all the time. And the hardest two things about clinical trials are, number one, finding qualified patients and getting them enrolled. And second is keeping them compliant with the clinical trial. Right now, the people get into these trials and they have to come into the clinic to have somebody look at their skin and see how it's doing. Could we do that with a skin scan at SkinIO? And we're confident that we could. We don't have the science for it today, but that certainly can and should be in our future. And then people could get, again, an at-home ongoing assessment of how their skin's doing and could integrate with products and lifestyle things you could do to help make your skin healthier longer.
Right. Well, skin cancer is certainly one of the most devastating things that can happen to our skin. There are so many other skin issues, diseases that if you had the right system in place that could scan for what those other issues are, not only topical issues with the skin, but I think we're learning more and more about how much what's happening inside of our body oftentimes shows up on the outside and can be a real indicator of some trouble brewing beneath the surface there. So to be able to maximize that capability and use that, and like you said, make it so easy where someone can just do this at home. They don't have to drive to a clinic to see a physician, to go through all of that. Yeah, you're removing a lot of those barriers for compliance by having that access. So it's going to be so exciting to see where this evolves for you guys.
Yep. Well, we're very excited and confident and got a team that's very passionate about this. And we need to continue to expand the team and expand our presence and visibility and see if we can earn our way to a more respected and productive, effective role in the marketplace.
Well, you mentioned earlier that, you're mostly working with employer through their benefits program and really launching a larger direct to consumer model. But if someone were listening now and wanted to utilize this just on a personal level, didn't have access through their employer, would they be able to do that?
Yes, absolutely. If they go to wherever they get their apps and download the SkinIO app onto their device, it'll help them create an account, and then it asks for a code. And we're making an offer just for this podcast for a $50 reduction in the price, and for the code. I didn't jot down, what was the code we agreed on, Beth?
Wellness 50.
Wellness 50, right? Thank you. Wellness 50. So put in the code Wellness 50, and the 239 charge will be 189, and it will then lead you through the scanning process, and that goes to the dermatologist for review, and then you'll get your report within 48 hours. And we would love to have people give this a try, and would especially love to hear back from them in terms of how they thought it worked and served them and how else we could be helpful.
Well, thank you for that offer for the listeners and viewers. It's very generous, and I'm going to make sure that I put in the show notes all the links, and we'll have that code listed down there so people can just click and get themselves connected and start this very easy process and potentially life-saving, if not necessarily scar-saving, like my situation process. So really appreciate that you guys are going to do that for them, and this has been such an amazing conversation. I really appreciate your time. So informative. We're all looking forward to seeing the amazing things that happen with this company as you continue to grow it and scale it and venture out into these other potential opportunities. So kudos to you for the good work and putting your heart and soul into something that's truly meaningful and can really save people's lives here. Really
Well,
appreciate
thank
it.
you. Thank you. Thank you, Beth. Yep. And if I can be helpful, steve@skinio.com, send me a note, and we'll do our best to make your skin journey towards good health and a long life as easy, accessible, and efficient as possible.
Well, thank you, Stephen. Everyone, check out that. We'll have, like I said, His website, information about the app, the code will all be in the show notes. Thanks again, Steve.
Okay. Thanks a lot, Beth. Take care.